9th Annual Black Tie Evening in support of Kingston General Hospital. Welcome to the Maharaja Bazaar. The Foundation is very happy and excited to be celebrating with so many of our donors and supporters who have made such an important contribution to our community, to our hospitals, and to the future healthcare for all of us. We are very proud to have your support and good company tonight. Thank you for joining us. This is a night for us to enjoy a wonderful evening of friendship, great food, auctions, and dancing. In other words, spend a lot of money. It is also a night for us to focus on our hospitals, to celebrate where we have come from, and to do our best to prepare for the future. With the redevelopment phase 1 behind us, we have turned our attention to equipment, and tonight we are raising funds for a green light laser. A little later on, Dr. Curtis Nickle will come to talk to you about the green light laser and what it will mean for patients in our region. Now, I looked at this. It's not about patients in our region. It's about men in our region. So when you look at this equipment, the men will be much more enthusiastic about the purchase of it. As you enjoy yourselves tonight at the Maharaja Bazaar, rejoice in the knowledge that your generosity is helping save lives and improving the quality of life for thousands of people in our region. That's thousands of men. Just before I hand things back to Greg, I'd also like to ask all of you to help me acknowledge our appreciation for our lead sponsors of this gala evening, Morven Construction and Bank of Montreal Harris Private Banking. Thank you so much for your generous leadership support. And to all of you, on behalf of the board and staff of University Hospitals Kingston Foundation, thank you for your support and for sharing this special evening with us. Enjoy.
Now, as Richard alluded to, we've come together this evening for a fairly specific cause, apparently for men. To share with you our fundraising focus for the night, it is my pleasure to invite Dr. Curtis Nickle for many of the details. Doctor?
Thank you. On behalf of the Department of Urology at Kingston General Hospital, it's great to be here this evening. Why are we here this evening? Well, I look out at the audience, and almost every man here tonight over 45 is presently experiencing a slow growth of the male organ situated, between the hips, the prostate, of course. So the prostate starts its life as a walnut-sized organ that helps us procreate, have children, and then it becomes a nuisance. We end up with prostate cancer, prostatitis, inflammatory pain, and almost all of us end up with enlargement of the prostate. Picture this, the prostate gland sits in the bottom of the bladder, and men, luckily women don't have to do this, but men urinate through it, sort of like through the hole of a Tim Hortons donut. However, some of the donuts don't have very large holes, and that's what happens as the prostate gland starts to enlarge. It encroaches on the bladder, causes very difficult urinating symptoms and obstruction, and it profoundly affects the quality of life of men and the activities that they want to do. Now, 50% of the men that I'm looking out there are going to experience significant voiding symptoms, and 25 to 30% of you are going to require treatment if you live long enough. And that's going to be medical or surgical. And to better understand why we're here tonight, I think it's best if we skip back 150 years and pretend that we're sitting around here, same age, looking forward to our future 150 years in Kingston. And if you developed benign prostatic hyperplasia or enlargement of the prostate gland, you are in trouble, unless you are very rich, because then you would go down to King Street to the metallurgist, and you would get them to develop out of gold or silver, or if you couldn't afford it, lead, a tube that's just just made for you, that your manservant or your private nurse would ram through your nether parts into your bladder twice a day until you developed infection or bleeding and died. Or if you lived in Wolf Island, your father, who learned from his father, would teach you how to use one of the river reeds hollowed out to pass into your bladder to empty it. But for most of you folks, what would happen is your bladder would be blocked and you'd end up with dribbling incontinence and become a social outcast because of the odor of stale urine that you would leave in your wake. However, you may develop bladder stones, block the bladder, and then you would probably die. Or you would start bleeding from your prostate. Bleeding from enlarged prostates is the most common cause of urogenital or bladder prostate bleeding in men. And then you could die. Or your bladder would block up and become a stagnant cesspool of urine that becomes infected. And then you will die. Or your bladder becomes blocked, the pressure builds up, it goes to your kidneys and you have kidney failure, and then you die. So you don't really want to be one of those 25% of men that live beyond your 70 in those days. So let's skip back maybe 100 years. Well, you still have the same problem for most of us. But if you're rich, there was a surgeon at the Kingston General Hospital who would open up your belly, split your bladder in half, and try and rip your prostate out through the bottom of the bladder. You had a 2 to 3 chance out of 10 of dying on the operating room table of bleeding. You'd have a 2 out of 10 chance of dying where you spent 3 or 4 weeks in Kingston General Hospital with urine leaking out of various tubes. But if you were successful, you walked out of the hospital a changed man. Now, 75 years ago, there was a surgeon at Hotel Dieu Hospital and one at Kingston General Hospital, and they used a different technique. The anesthetists knew what they were doing, antibiotics were coming on the field, and patients did do better, but it still wasn't very good. So let's hope that we skip back 50 years and we're manning Kingston with this problem. You would have met a gentleman called Dr. Nate Berry, the founder of the Department of Urology at Kingston General Hospital and Hotel Dieu Hospital, who brought to this area, southeastern Ontario, a new operation called transurethral resection of the prostate. It changed the game. Kingston was one of the very few small cities, and in fact we beat Toronto and almost beat Montreal in developing this type of surgical technique, in which a steel rod is placed under anesthesia into the prostate, and using very fancy lenses and an incandescent lens, we would, underwater, cut out the prostate from the inside. You did pretty well, and over time we got better at it. The instruments improved, the technology improved, and generations of urologists who trained in Kingston spread around the world teaching this method, which is now the gold standard technique for doing prostate surgery in the world. And Kingston has become recognized as a center of excellence in transurethral resection of the prostate, and we spend time going around the world teaching others to do this. However, it's still a surgical operation. Prostate is cut out from the inside. There's bleeding. Patients are in hospital 1 or 2 days with a catheter. Patients have a chance of 1 to 2 chances out of 20 to return to the hospital, be admitted for complications such as bleeding. We can't do this in a patient who's anticoagulated on Coumadin or warfarin or Plavix. So there are difficulties with this operation. So let's skip to the future. And the future, actually, because of you tonight, is now, actually 2013. A patient with this condition will come into hospital in the morning, he'll have a spinal anesthetic, and joke with his anesthetist about the game the night before. Well, the surgeon is using a technologically advanced fiber optic camera inside the prostate and using a laser beam about the same wavelength as the green light to vaporize the prostate with almost no bleeding. In fact, it can be done in men on anticoagulation. Patient does well, stays in hospital a couple days, goes home, has dinner with his family. Next day he wakes up with or without a catheter, depending on the type of surgery. If he has a catheter, a nurse comes to his home, removes the catheter, and patient does well and recovers very quickly and is unlikely to return to hospital. So this new technology that you guys are helping with is going to benefit the males. And I look around, it's going to benefit many of you guys, this dinner that we're having tonight and the support that you give. It's also going to benefit the hospital because we're going to save resources and beds. And for that reason, I would like to thank the wonderful people who organized this event, and most of all of you that have come tonight to support the Department of Urology and Kingston General Hospital in obtaining the new green light laser. Thank you very much.
All right. Happily, I'm only here for about 30 seconds. I don't have to follow that. At this time, I'd like to call on Tom Buchanan, Board Chair, and Leslee Thompson, CEO of Kingston General Hospital, to come up and give their greetings and say a few words. Good luck.
Good evening. Thank you, everyone, for joining us tonight. This is just a spectacular evening, and we are so pleased to see so many friends and colleagues gathered today for a very, very good cause for the urology department, as we heard earlier, and in support, most importantly, for the hospitals here in Kingston. We're particularly glad to report that this year, and with the focus of this event on the program at KGH, wanted to just let you know that this has been a fantastic year for the organization. We are really thrilled to be able to report to you that the performance improvement plan is completely behind us. We have balanced the books the first time in 16 years, and we are financially strong and healthy. We also just underwent accreditation, and 3 years ago we were accredited with conditions, and this year we skipped 2 levels and landed with a handful of other Canadian hospitals as accreditation with exemplary status, meeting 99% of over 2,000 standards. And the one actually that I am the most proud of on behalf of the entire KGH team is that this year Kingston General Hospital was recognized as the first hospital in Canada ever to be given the NRC Picker Award for our innovation in patient-centered care. And the work that we're doing with involving patients and families and decision-making at KGH to really transform the patient and family experience and to bring the commitment to patients to life was recognized, and I got to go down to Chicago and receive that award in a room full of an international audience on behalf of KGH, on behalf of Kingston's and Canada, and it was just one of the most incredible highlights of the past 4 years. So we are doing well, and thanks to your many, many contributions and support, we're enjoying the facilities that are just incredible from phase 1, all of the programs and services, and we're looking forward to working with you in the future to make the partner hospital renovations and new developments happen, and you'll stay tuned for more at KGH because there's lots more great things to come. But thank you so much for all your great support. It means so much to us to have your involvement, commitment, and support. Thank you very much.
Thank you, Leslee. You know, I felt like she was doing a performance review to me, and to remind me of all the great things that Leslee and her team has done. But it's truly been remarkable, the progress that's been made at Kingston General Hospital since Leslee has joined us in her team. So I'd like to also publicly congratulate you for all the great awards you have won and the great things that have happened at KGH. Now, on behalf of the Board of Directors of KGH, it is my pleasure to express thanks to our partners in healthcare. And we have a number of individuals. I just wonder if you could just stand and wave that are here tonight.
And to re-begin the program, if you will, please welcome Denise Cumming, CEO of UHKF.
Thanks so much, Greg. It's my pleasure at this point in the program to just acknowledge the amazing volunteer committee who put this wonderful event together for us. And as I begin my remarks, I'd like to invite our co-chairs, Rula Vecchios and Hershey McKeegan, to step forward, please. Hershey and Rula. This year's Maharaja Bazaar theme, I had all kinds of images in my head of what it would look like and what the exotic food would be like. But I must say, this exceeds all my expectations. The room looks beautiful tonight, doesn't it? And I know that we were very proud to be involved in supporting the purchase of a green light laser, and I want to just acknowledge that Rula Vecchios, one of our co-chairs, was very, very active in advocating for the green light laser to be the beneficiary of the proceeds this year. So thank you for that, Rula. I'd like to invite all the members of this year's committee to stand and accept our thanks, and they are Allison Hinton, Whitney Guerra, Hershey McKeegan, Katrina Moniz, Jeanette Prorock, Marie Turnbull, Julia Redfern, and Rula Vecchio. Please join me in thanking our committee. And Rula and Hershey, I would just like you to accept these as a token of our great appreciation for the wonderful evening that you've created for all of us.